two investigation reports that were conducted by the Health Ombud about two hospitals, which is Vers Donald Gordon Medical Center in Gauteng and Pietersburg Provincial Tertiary Hospital in Limpopo. In terms of the program, we are going to have the opening and welcome remarks, which will be delivered by the chairperson of the board of the Office of Health Standard Compliance, Dr. Ernest Kinoshi. And also, immediately after that remarks, we'll have a release of these two investigation findings and recommendations by the Health Ombud, Professor Taole Mokoena. And then after the release of the report, we're going to have an handover of the report. The report will be handed over to the Minister of Health, Dr. Aaron Mutsaledi, and also the OHSC Board Chairperson, Dr. Ernest Kinoshi, and also to Vers Donald Gordon Medical Center CEO, Dr. Sue Tega, and also the acting HOD for Limpopo Department of Health, Mr. Zek Mawasha. And then after the handover of the reports, we're going to have the remarks by the Minister of Health, Dr. Mutsaledi. And after that, we're going to allow members of the media to ask questions, and from there, our principals will provide answers to those questions. And then after that, we'll have the vote of thanks by the Chief Executive Officer of the Office of Health Standard Compliance, Dr. Siphiwe Mdaweni. Without wasting much time, I'm going to invite the chairperson of... in terms of the introductions, I'm going to introduce the panel that are seated here. We've got the Minister of Health, Dr. Aaron Mutsaledi, and then we've got also the board chairperson of the Office of Health Standard Compliance, Dr. Ernest Kinoshi. And then we've got the Health Ombud, Professor Taole Mokoena. We also have the acting HOD for Department of Health in Limpopo, Mr. Matomi Mawasha. And then we also have the CEO of Donald Gordon Medical Center, Dr. Sue Tega. And also, we've got the Pietersburg Provincial Tertiary Hospital CEO, Mr. Philip Kruger. Thank you so much. I'm now going to invite to the podium the CEO, the chairperson of the board of the Office of Health Standard Compliance, Dr. Ernest Kinoshi. Thank you.
Thank you, Mr. Matsaganya. Good morning, Honorable Minister, Dr. Aaron Mutsaledi, distinguished Limpopo HOD, acting HOD, Mr. Matume Mawasha. Good morning to our Health Ombud, Professor Taole Mokoena. Good morning also to all the OHSC board members present here and participating virtually. Good morning to the CEO of OHSC, Dr. Mdaweni, Siphiwe Mdaweni. Also to the CEO of Wits, Donald Gordon Medical Center, Dr. Sue Tega. Good morning to the COO, Dr. Mabubula, OHSC. We also greet the CEO of Pietersburg Provincial Tertiary Hospital, Mr. Philip Kruger. We also greet, I think, the DG in absentia. Good morning to ladies and gentlemen, esteemed guests, members of the media, and all protocol observed. Good morning to each one of you. It is both a privilege and a pleasure to convene among such a distinguished gathering of dignified persons, all unified in our mission to enhance the quality of healthcare within our nation. As the chairperson of the OHSC, which is the Office of Health Standards Compliance, I extend my warmest greetings to attendees, particularly members of the media here and those joining us through various digital platforms. Your collective presence today underscores our shared commitment to improving quality of healthcare in our country, an imperative we hold in the highest esteem. The occasion is far from ordinary today. It represents a significant moment for us to come together and engage in meaningful dialogue regarding the pressing challenges confronting our healthcare system. The findings emerging from investigations carried out at the Wits, Donald Gordon Medical Center, and Pietersburg Provincial Tertiary Hospital compel us to delve deeper, transcending mere statistics and reports. These findings serve as a profound reminder of our critical duty to ensure that every patient receives safe, effective, and compassionate care at all healthcare establishments nationwide. I would like to take this opportunity to convey my heartfelt appreciation for the unwavering commitment of the investigators and independent experts whose diligence and expertise have shed light on the complexities of the two cases being addressed by our Health Ombud today. Their steadfast dedication to upholding the mandate of the Health Ombud and the Office of Healthcare Standards alongside their Office of Health Standards Compliance, alongside their rigorous adherence to the highest standards of healthcare, is a source of inspiration and trust in our processes. I urge all health establishments to remain focused on our shared goal, that is to glean valuable lessons from the findings and implement meaningful changes that prioritize the health and well-being of all South Africans. Thank you for your presence and engagements today. I look forward to the dynamic discussions ahead and collective progress we can achieve together. Thank you very much, Mr. Matlakane.
Thank you so much, the board chairperson, for those opening remarks. I'm now going to allow the Health Ombud, Professor Taole Mokoena, to officially release the two reports. Over to you, Prof.
Good morning. Thank you very much, Mr. Matlakane, and in particular for allowing me to do work. I thought you would invite me to do work, but may I at the outset align myself with the greetings that the board chair has extended to all of you here present today. My repetition won't make them any better. But what I do want to greet is also the members of the families that that are bereaved if they are here present. Is there any member of the family that's here? Oh, thank you very much for coming and welcome. And of course, I should also greet those who are listening online that we can't see today. At the outset, you see, to rely on a human being is kintoisili. Let's start the slides from the beginning. That is. Okay, I'll do it myself. Good, but it's fine.
You will do it when Linda will play exactly because they are not aligned.
I don't understand, but that's fine. I think at the outset I need to mention that the reports that we do present and publicize in the manner that we are going to do the two today, they are only a drop in the ocean of the work that we do. Every day we release findings of investigations that we do, but the ones that we here stand before you are those that bear particular messages and learnings that we need to pick up, such that whatever infractions had happened should not be repeated in the future. Today, we present findings of two investigation reports that were conducted in terms of Section 81A of the National Health Amendment Act. The investigations were conducted in line with the National Health Amendment Act and the procedural regulations, ensuring fair and expeditious progress. The results are from the investigations of complaints of a death of two patients, one at the Wits Donald Gordon Medical Center, that was lodged by the deceased wife, Mrs Tebogo Mabubula, and another one was at Pietersburg Provincial Tertiary Hospital from a complaint lodged by the aunt of the deceased, Dr Mamphela Ramphele. One wishes to briefly remind the public of the Health Ombud's mandate. Under the sections that are already mentioned of the National Health Amendment Act, the Ombud is empowered to receive and consider, investigate and dispose of complaints relating to non-compliance with procedural norms and standards in a fair, impartial, and expeditious manner. The Ombud and the team, they operate independently without fear, favor, bias, or prejudice, guided by the principles of accountability, fairness, and compassion. We shall first discuss the findings of on the medical care and the death of Mr Mabubula, who himself was a medical doctor, who was managed at the Wits Donald Gordon Medical Center. From now on, I'll just call it Wits Gordon. And we'll conclude then by discussing the care of Mr Ramphele at the Pietersburg Provincial Tertiary Hospital. From now on, I'll just call it Polokwane. The complaint about the death of Mr. Mabubula was lodged on the 20th of May 2001 by his wife, whose name I've already told you, regarding the care of her late husband, Dr. Edward Mabubula, at the Wits Garden. Before we proceed, I need to acknowledge two investigators that helped us in the investigation of this particular case, which are Ms. Helen Petwane and Mr. Douglas Mapeto. Mr. Mabubula had a significant medical history of metastatic colon cancer, previous pulmonary TB, and more importantly, had lung resection for metastasis. He happens to also have been hypertensive. On the 27th of March 2021, he attended the Wits Garden oncology ward for removal of an ambulatory chemotherapy pump that had been put up 2 days earlier. The patient was subjected to a routine screening for COVID-19, but more importantly, no baseline clinical assessment or essential clinical information was recorded before the procedure was undertaken. The chemotherapy port was flushed while the patient was seated. On completion of the flushing, he stood up to wear his shirt, and he suddenly felt unwell and collapsed and required emergency care. The patient was resuscitated and admitted to the medical intensive care unit, where he remained until his death on the 3rd of June 2021. An urgent brain CT scan was performed, demonstrated a right frontal cerebral embolism. The Health Ombud commissioned an independent experts who confirmed that the chemoport flushing procedure resulted in the cerebral embolism through a retrograde venous airflow. This is a very rare complication, but it's well documented as a consequence of manipulation of indwelling central vein catheters. The patient's condition gradually deteriorated during his stay in the ICU due to a combination of factors. Among them was the chemo-resistant advanced hepatic and pulmonary colon cancer metastases, reduced lung capacity, and poor pulmonary reserve due to previous pneumonectomy for the metastasis of the colon carcinoma. He developed hemiparesis and transient epileptic seizures from the cerebral embolism that resulted in a cardiovascular, cerebrovascular incident. The other factor was a respiratory infection, which resulted in part to pulmonary respiratory failure. Mr. Mabubula demise on the date that I've already stated, and the certified cause of death was natural cause, with respiratory failure as the immediate cause. The Donald Gordon had a long-standing informal courtesy practice of removing venous ports needles after chemotherapy that were carried out outside regular hours, where no patient files were created or retrieved to document the clinical status and the procedure carried out on patients on the day, ostensibly in order to save patients from payment of hospital fees. This practice deviated from the regulations on patient records and from the facility's own standard operating procedures, which recognizes air embolism as a possible complication. The lack of documentation constitutes a breach of duty under the National Health Act, which requires the maintenance of proper health records for all users of the health services. The Health Ombud made a few recommendations, which are that the Wits Warden must develop and implement formal protocols for documentation of oncology outpatient port needle removal procedures, including the creation of a dedicated medical file for each patient and complete documentation of clinical assessment and procedures. We require proof of implementation that it should be submitted to the Health Ombud. I must say that even before this time, the Wits Warden has actually started implementing this recommendation. And Mrs Mabubula, so that they can finalize the resolution of this problem within 4 months. The matter is now considered closed by the Health Ombud, as it has been thoroughly investigated and finalized in accordance with the regulations. The Office of the Health Ombud will take no further action on this matter. Now we turn to the second case. The second investigation is the death of a Mr Pitsi Ramphele at Pietersburg Hospital. At the heart of this inquiry is a profound tragedy of death of a patient that also exposes the systemic failures in our public health system. The Constitution of the Republic under Section 21 guarantees that everyone has a right to have access to healthcare services. Before we proceed, I should acknowledge the investigators who helped. The complaint was lodged by Dr Mamphela, who is the aunt of the patient, on the 27th of March 2025, alleging medical negligence in the treatment of her nephew at the Pietersburg Hospital. The evidence indicates that the patient first sought medical attention at Retabile Community Health Center on the 26th of November 2024, before he was referred to Pietersburg Tertiary Hospital, where he was diagnosed with adhesive small bowel obstruction. Tragically, the patient died on the 28th of November, in other words, 2 days later, while still awaiting surgical intervention. The investigation uncovered multiple instances of substandard care, regulatory non-compliance, and professional misconduct on both the healthcare establishment that he visited. I will go through the allegations one by one, and as I do, I'll pronounce the findings as well as the recommendations that the Health Ombud is making on each of those allegations. The first allegation is that there was a delay in opening a patient file while he was at Retabile Community Health Center. Mr Ramphele waited nearly 4 hours before a medical file was opened for him. This delay was caused by severe staff shortages, inadequate equipment. The health center only had 2 computers for about 300 daily patient visits, and also there was poor administrative management. The waiting times were not displayed publicly in violation of the Regulation 22 of the Norms and Standard Regulations. The findings, therefore, substantiated the delay, and it is recommended that the institution should recruit administrative staff, provide additional equipment to reduce registration delays, and they should also display the expected waiting times. Allegation number 2 is failure of triage of patients, of the particular patient. The so-called triage area lacked essential medical equipment, and only enrolled nursing assistants were deployed at this site, and this is outside their code of practice as well as competence. The nurses were unfamiliar with the South African triage scale, and this scale is critical in categorizing patients' acuity and prioritization. And the finding, therefore, found that the institution failed to triage the patient. The allegations were substantiated, and it is recommended that the institution must retrain nursing staff on the triage system and ensure that only qualified personnel perform triage. Allegation number 3 is failure to be seen by a doctor. After assessment by the nurses at 3:30, the patient was referred to the for the doctor's examination, but all doctors had left before he could be seen. Security guards instructed the patients to go home, and therefore the findings that the Health Ombud made is that the allegation that Mr Ramphele was not seen by the doctor was substantiated. This is in clear violation of patient rights and professional duty of care. The recommendation is that there should be strict monitoring of doctors' attendance and their timekeeping, including use of biometric systems. We recommend that the referral of implicated doctors and nurses to their respective regulatory councils for professional misconduct. Allegation number 4 is failure of triage of the patient at the Pietersburg Tertiary Hospital. Triage was not properly performed at the Pietersburg Hospital. Again, enrolled nursing assistants were deployed without supervision at that hospital, contravening their scope of practice. The findings, therefore, are the allegation of failure of triage of the patient was substantiated. And the failure of triage was a systemic triage failure at both the hospitals. And of course, we make the same recommendations that the staff must be trained, and only qualified staff who can work within their scope of practice should be deployed there. The findings the allegation number 5 is inadequate monitoring and delayed surgical intervention. After being placed on a non-operative management regimen for adhesive small bowel obstruction, the patient spent 21 hours without review by any doctor. When his condition deteriorated, intravenous access had been lost, and the staff struggled to re-establish IV line. Clinical and radiological evidence clearly indicated that surgery was required, and yet this was not done. Now, I need to remind you that the Pietersburg Provincial Tertiary Hospital is actually a teaching hospital. So they should know how to treat adhesive small bowel obstruction, which is quite common but serious surgical problem. The lack of monitoring and delayed surgical intervention directly contributed to the patient's death. The recommendation is that the implicated doctors and nurses should be referred for professional misconduct to their respective regulatory councils. Allegation number 6 is denial of post-mortem services. The family's request for a post-mortem examination was denied on the basis that the hospital did not offer such service. The family had to resort to a private sector for post-mortem services. The findings are the allegation of denial of post-mortem services was substantiated, and this violates Regulation 7, bracket 2A. The recommendation is that the CEO of the hospital, the surgery head, clinical head of department, should induct all doctors on availability of postmortem services in the province. We made some additional findings, which are that there was falsification of clinical record by nursing staff at the Retabile Clinical Community Health Center in order to conceal evidence and thus mislead the Health Ombud. There was inadequate patient waiting areas at this community health center, exposing patients to harsh weather conditions. There was a total lack of supervision of medical interns and registrars at the provincial hospital. In both the institutions, there are extended acting appointments in the management positions where the acting people are not being remunerated for. This leads to to poor morale and instability of the management cadre. Equipment shortages were also experienced, including missing cardiac monitor cables, empty medicine stock boxes in the surgical ward. The further recommendations that we make is that the Limpopo Department of Health and the affected health establishment should, one, establish a task team that will oversee the implementation of these recommendations and provide quarterly progress reports to both to the Limpopo Department of Health, HOD, to the OHSC CEO and the Ombud. They should improve the infrastructure, including making adequate patient waiting areas and replacement of missing medical equipment. They should fill all management positions to restore leadership stability. They must conduct clinical audits and mortality reviews at the provincial hospital to prevent recurrence of similar incidents. In other words, they must learn from these clinical audits and mortality reviews so that they can be geared not to repeat. The miscreant personnel, registered nurse Makubela and registered nurse Tobejane, must undergo a disciplinary inquiry. The Health Ombud considers reporting these miscreants to the criminal justice authorities. It is concluded that the human and the fiscal resource shortage severely compromise quality of care in those two institutions. Triage protocols are not being followed, resulting in dangerous delays of appropriate clinical intervention. Junior medical staff and nursing staff function unsupervised beyond the scope of practice and competence. Leadership failures and extended acting positions undermine accountability and morale. Cumulative effect of these systemic failures in the is a denial of safe quality health care and a direct violation of the Constitution of the Republic. In closing, we would like to say that the tragic death of Mr. Ramphele was preventable. It reflects not only the individual lapses, but also the systemic weaknesses that permeates most parts of our public health system. The Ombud needs to are not negotiable in nature, but should be corrective, aimed at rebuilding trust and ensuring compliance and safeguarding quality and safety of our healthcare system, as well as the dignity of every patient. Thank you very much. Kale Tlepi.
Thank you so much, Prof. Mokoena, for the two reports. I would like to emphasize that the two reports are available on the Health Ombud website, which is www.healthombud.org.za. Thank you so much. I'm now going to invite in the front the Ombud to hand over the reports to the Minister of Health, Dr Mabubula, and after that we are going to also invite the chairperson of the Office of Health Standard Compliance, Dr. Kinoshi, to also receive a copy of the report, and also will also invite the CEO of VES, Donald Gordon, Dr. Tega, to also come to the front to receive the report. In that order, and also from there, after that, we are going to invite the acting HOD for Limpopo Department of Health, Mr. Mawasha, also to come to the front to receive the report.
Some part of two of them. One at a time, why not? Thank you.
Thank you so much. We are now going to invite the chairperson of the OHSC board to also receive copies of the report. The next to come is VET's CEO, Dr. Tega, also to receive copies of the reports.
No, just yeah, I yeah.
And also Mr. Mawasha, the acting HOD, Limpopo Department of Health. Yes, thank you so much, Prof, for handing over those two reports. Thank you so much.
Sorry. See whatever.
Apologies, CEO. Also to Dr. Kruger from Pietersburg Provincial Tertiary Hospital. Thank you. Moving along now, we're going to invite to the podium the Minister of Health, Dr. Aaron Mutsaledi, to give us the remarks about the briefing. Over to you, Minister.
Thank you very much, Program Director, and thank you to the Health Ombud. Let me also say everybody else has been greeted before. I don't have to repeat that. But I want to start by extending our condolences to the families of the bereaved and extend my own personal apologies to the families about what they've gone through, especially in the case of Limpopo, the Retabile Community Health Center and Polokwane Hospital. I want to extend those apologies because I haven't seen something like that before happening in a health center. But I want to say to the Ombud that you have once more done the work that we've been hired for which we need to be grateful as a country. Back then, when I was the Minister of Health and established this office of the Health Ombud, people were confused and asking me, what is the role of the Health Ombud? Because it was a new office. People have never heard about it. But at that time, Advocate Taole Mokoena had popularized the office of the public protector. Everybody knew it. So it was easy for me to explain why there must be a Health Ombud. I simply said, it's a public protector of health. We need somebody who will come and protect the healthcare system from whatever misdemeanors that may happen. And that's why the office was established. And its first incumbent, Professor Makgoba, and the second incumbent, Professor Taole Mokoena, have done exactly what the office was hired for. I don't know whether it means every time we must hire a professor for this office. I don't yet know whether it was a coincidence, but they've done the job for which they were hired, definitely. You know, I want to say the issue of Gordon Center at Wits has been very unfortunate. The Ombud said so. It has been a very unfortunate incident, painful as it is, and the Ombud rightfully, after conclusions, has closed the case. But CEO, the job of mediation with the family will lie on your shoulders, doctor. It must happen, and happen very fast with the family. But the Ombud has made these findings. It was a very unfortunate incident. We have seen some of these things happening in health centers. On the issue of the events in Polokwane, I want to say if the two facilities, if they were a human being, I will diagnose them as suffering from multi-system organ failure, because almost everything did not go well. And as human beings, I went through the report thoroughly as you were presenting, at least the findings that we have got here. And some of us have been in this area of work. I have been an intern before, even though it was 41 years ago that I was an intern. And I want to emphasize that even as a medical intern, I would not have treated a patient this way. I would not have failed to treat a patient this way. I want to emphasize that. Now, you said Polokwane Tertiary Hospital is a teaching hospital, yes, because we have got the university there. It's only that we are still building them a new central hospital, which I think is 40% completed. But this is no excuse for what has happened here, Prof. There is absolutely no excuse of what has happened here. Even stopping the issues of management, just the clinical care. I've never seen senior doctors who will diagnose or provisionally diagnose adhesive intestinal obstruction and treating a patient this way. Putting a patient on conservative management is done. I've seen it being done by professors or my professors of surgery. We have done this many times. But I know when you do that, you observe the patient very frequently and prepare them for theater, because you can need to go there immediately. That doctors there took 21 hours with a patient like that before saying it can't be forgiven by any standards. And I don't usually differ with the reports of the Health Ombud, Prof. I've never done so before. I always accept them as they are and go on. But please allow me today to express my bit of differences, because I want to state clearly that this has got nothing to do with lack of equipment or staffing. I've worked in hospitals and facilities which are much, much more or less equipped than Polokwane Hospital. I've done that during my career in health. And still, with very little equipment, we don't do things like what has happened here. I mean, how do you describe a nurse who go to falsify records and say it's because of shortage of staff and equipment? It can't be. That nurse is a criminal. It's an absolute criminal. And my question is, should we have such criminals in the nursing care? This morning I told you Health Ombud, and I'm going to repeat again. The last time I experienced something like this was 41 years ago when I was doing internship, the issue of record. One fellow intern who was working with us altered records in a file of a patient because the patient was having high blood sugar, and he knew that as per protocol, he was supposed to stay awake all night. We all did that as interns. Once you have got a patient with a high blood sugar, you stay awake for the whole night because you must take care of them every hour, taking blood and giving them insulin. It may take you 10 hours to lower blood sugar to a level where you can go to sleep. But that intern altered the records and put a lower blood sugar in order to go and sleep. That's murder. And he was doing internship with us. We were all expecting at that time that he won't pass internship, but he passed it. And I suspect it's because it was during apartheid and he belonged to a color of a skin that can be forgiven, even for murdering. I don't need to go any further than that. But altering records cannot in any manner be attributed to shortage of staff and equipment. It's just outright criminality. Secondly, Prof. National Ombud, the fact that doctors left before seeing all the patients can also not be attributable to shortage of staff. They were there, the patients are there. If you work in that profession, you can't say it's 4 o'clock, I'm knocking off when patients are still there. We have never done that. We've never done that. The fact that they just stood up and left. And acting HOD, these people are paid salaries. The law is that you work for 40 hours a week. They didn't work for 40 hours here in this case, just leaving before. Because it might be that they left before in other cases where you didn't see them. So this must also be considered, that it has got nothing to do with shortage of staff. I will even dare, with due respect, Ombud, the issue of having 2 computers and a few administrative staff, there are hospitals that are doing much better even with that. During my time, we have never had computers, but we never experienced things like this. I also don't think that should be an excuse that we must use to somehow have lesser rage because of that. The issue of triage, Prof, is also an issue of management, because I believe triage is standard in every facility. Because when people arrive there and sit there, you don't know who must be seen first. In the hospital, it's not first come, first serve. We don't run hospitals like that. It's not first come, first serve. If you arrived by ambulance and it's urgent, you need to go to theater, you can't say, no, you came later than so and so, you must see them first. That's the importance of triage. And triage is an initial diagnosis. And that it can be done by an enrolled nurse is also completely unforgivable. Triage is it's an initial diagnosis that this one can be in danger now. Please move them to the front. Please rush to theater. Please prepare this and that. It's not done by junior people. So it's also something that cannot be forgiven. So everything that happened there is unacceptable to me. There ought to be a DC in terms of the public service rules. And I'm happy that we say this must be referred to their professional councils, because I want to see whether the Health Professions Council and the Nursing Council will make a ruling that these people must continue being in their professions when they behave like this. I'm eagerly going to see that. Of course, they are an independent structure. I don't control them, even though they report to me politically. But I stand to see whether a person, a nurse who deliberately falsify a patient's record is still allowed to stay in the system as a nurse. What else can they falsify? Because the doctor or health worker patient confidentiality is also based on trust. As health workers, when somebody is in your hands, you can kill them anytime if you so wish. And I was taught at medical school that when they give you a pass on 6th year, prof, you've been an examiner, you know. When they told us, unless they no longer tell students these days, they told us when we passed and said, look, don't be proud that you are a doctor. Don't, because you know very little about medicine. We are passing you to go and learn. We are releasing you to go and learn medicine. You don't know medicine. The reason that we are passing you is because we have determined that you are safe. You can't kill. That's what I was told. That if somebody dies in your hand, it won't be because you killed them. It will be because it was inevitable. That's why we are releasing you. Those who we are not convinced that they are not in that category of not killing, we don't release them. They must repeat. That's at least what we're told when we're taking oath as interns. I don't know whether that has changed because I've not been at universities for a long time. So the fact that professionals can do something like this is absolutely not acceptable to me. And it's something that must be harshly dealt with. Lastly, Prof, on your conclusion, no closing reflections, Prof, I once more apologize that I never differed with the Health Ombud on any findings. But today I apologize and say, allow me that liberty. On the closing reflections, I know you are acting like a compassionate father when you say the report primarily is not meant to be punitive but corrective in nature. The statement worries me as a custodian of the healthcare system because you need harsh consequence management for people to know that they shouldn't do things like this. What happened at Wits Gordon Center can be described in this way. That is not punitive but corrective. But we are correcting some mistake that is unfortunate has happened and led to somebody's death. But we cannot describe what happened in Polokwane. That's my home province, unfortunately. We cannot regard it this way. This need, very serious punitive measures for other people to see that they shouldn't do something like this. Not ever to any other patient or not any other human being. I mean, how do I describe doctors seeing that there are patients there? You just stand up and go home. Nobody goes to a hospital because they are happy. Every person who goes to hospital, there's a problem. By the time you wake up and decide to go to a hospital, there's a problem and a serious problem. You're not just going there to joke. And for doctors just to stand up and say, I'm leaving and leaving patients there, I've never done it. And for information, Prof, you can go and check. I once worked in St. Rita's Hospital, where I was the only doctor working in the whole hospital during our time. Of course, the interns this day tell you, no, it was during that time. You work alone in a hospital. You even breach the laws, but you breach them in favor of the patient. Like realizing that somebody cannot travel 300 kilometers to what was then Karangua Hospital, which was referral, a pregnant woman whose uterus is about to rupture. And you have to choose between putting them in the ambulance to travel 300 kilometers or doing a Caesar alone, which is forbidden by the Health Professions Council. And you choose to do the Caesar and see the Profession Council later because I want to save these women. And we have done many Caesars. And I'm challenging you to go and check. All the Caesars I've done alone, not a single woman died. Because we determined that this person must leave because he's under my care. We used to do that. Now for doctors who are working so many, the same hospital I'm speaking about, St. Rita's, where I worked alone, Dr. Pasha, the deputy minister, also at some stage worked alone there. Today, they've got 52 doctors. But I went there a few months ago. I went there on an unannounced visit. I had to fire the CEO, fire the nursing manager, and fire the clinical manager. Because they were complaining about shortage of staff and shortage of... With 52 doctors in a hospital, well, you will say the population was small at that time. So I'm just trying to mention this, that we must not make excuses of lack of facilities in the public healthcare system. Many other countries on the continent and elsewhere in the world do not have all the facilities they need, do not have all the staff members they need, but they still treat patients with care. And I want to argue very seriously. If this patient was treated with care, I agree with you there, Ombud. What has happened could not have happened. This was largely preventable, especially the issue of not taking the person to theater with adhesive small bowel obstruction. How do we forgive that? And this, Prof, remember, it's not a small district hospital, it's a tertiary hospital. It's a tertiary hospital, which, as you said, is a teaching hospital. And teaching hospitals have got medical students, have got interns, have got consultants, have got registers. They've got the whole layer of professionals, some of whom are in training, others are teaching others and all that. And so something like that should not have happened there. So for that reason, I really do not accept the fact that we must just do corrective changes here. There must be as punitive as possible. Very serious consequence management so that human beings must know that if they are hired to take care of the lives of others, every life is precious. You can't play games with it. Thank you very much.
Thank you so much, Honorable Minister. I'm now going to open the floors for questions, and immediately after those questions, I'll ask also my principals to respond to those questions. And then when you ask the question, you should indicate your name and also the media house that you are also representing. The floor is now open for any questions. Yes, I've noted. Any other question? Okay, go ahead. Thanks.
Hi everyone, I'm Nabila. Two questions. for the panel, for the Minister as well. In terms of the cases, now that we are reaching the end of the year, can you sort of give us an overview of what the Ombuds Office has dealt with this year in terms of the number of cases, investigations, and what were some of the major ones that you've dealt with? And then on the second question, I'm currently looking into an incident. It's an alleged medical negligence case that happened 18 years ago in 2007. And this particular patient still thinks that she has a case. Is there a specific time period for these investigations? You know, does someone have recourse for a case that's happened 18 years ago? Those are my two questions. Thank you.
Thank you. I just want to check, before I can allow the Minister and also the Ombud to respond to those questions, whether do we still have any questions? Let's see. Online, do we have any?
No online questions.
Okay, thank you so much. I'll hand over to the...
It's like they're all his.
Yes.
There's not that going to be. Yeah. Except that on the last one, I might come and make a remark.
Thank you very much. You said you're Nabila? Yes. Thank you very much. The number of cases that we've seen, I don't have the exact figures here in front of me. I should have photocopied them into this hard drive, but this hard drive is full. But what I can tell you is that for this year, that's the financial year, we've seen more than 1,000 cases, and out of that we're going to investigate about 68, and they've come down only slightly in terms of the numbers that have been logged, but the seriousness is increasing. But if you're really interested, you can leave your contacts, and then we'll send you. We've got a chart, a table that shows the number of cases over the past 3 financial years up to the current. The prescribed period, I think that's what they say in law, the prescribed period is 2 years. But I need to explain about that. It's 2 years after you have known that you have a problem. And even if there's something happened 20 years ago, but you come to know about it in the past year or so, you're still free to bring it forth. And also, even though we say 2 years, if you had known it and then you tried to address it through other authorities, and then you fail to get your desirable outcome within the 2 years, regardless of when the occurrence was, we'll entertain it. Are you? Thank you. Thank you.
Thank you very much. Yes, I just want to remark that cases that we send to the Ombud or come there are obviously increasing as people become aware. And the Ombud decide that some of them are not even worth investigating, in which case he will write to the people and tell them so, or others investigate and make a finding and put the results online. As he said, the cases that he brings here are those which are very serious, from which we'll learn, like these 2 cases. But every day, they release cases online to tell people. Remember, the unfortunate part is that because there's a rise of medical legal cases, many patients just believe there's money to be made. Yes, and they wake up every day, anything and everything that happens, they believe there must be some monetary compensation. So they come almost every day, even to me, because there are those who don't know the Ombud. They send them to me, and I check them. If they are serious, I send them to a Ombud. So this is an everyday happening. On the last case, Prof has already answered about whether cases expired. There's a legal term they use there. What is it? Huh? Yes, I never get used to that word because prescription is what doctors do all the time. So I don't know why lawyers interfered with our term. You know, I thought that was our term. Yeah, I just want to state that this does not apply to cerebral palsy. There is a constitutional court case that any person who suffered cerebral palsy, the cases do not, in fact, I think there's a time limit. I think it's for 18 or 19 years. They can still lodge a complaint. That's why one of the reasons that you saw medical legal cases rising is because after that ruling, we have lawyers who literally goes to the schools of disabled to search kids. Yes, there are scouts all over. You can check, especially in Gauteng, all over Soweto. There are scouts where they go and say, oh, this child, this and that is, you know, let's get the doctor who delivered this baby or the hospital and all that. And so it's all about money, unfortunately, when it's supposed to be about human beings. But I just want to clarify that cases of cerebral palsy do not prescribe. They still allow them. The argument by the judges, which I buy, is that if I'm the one who suffers from that, and I only discover it after 19 years because my parents were not educated, I shouldn't be punished because I was a baby. That's the reason that they are using. So all the others can prescribe, but not cerebral palsy. Thank you very much.
Thank you, Minister, and also the Ombud. Without wasting much time, I'm going to invite to the podium the OHSC CEO, Dr. Spium Daweni, to give us the vote of thanks and closure. Thank you, sir.
Thank you very much, Program Director, Mr. Matlakanya. Ladies and gentlemen, our esteemed guests, valued colleagues, members of the family, and members of the media, as we bring this significant media brief to a close, allow me to extend our sincere gratitude to our Minister of Health, Dr. Motsoaledi, for his presence and unwavering commitment in strengthening our health system. I also wish to thank and acknowledge the exceptional work of the Health Ombud, Professor Mokoena, and his investigation team, comprised of Ms. Musima, Ms. Masemola, Ms. Petwane, and Mr. Mapeto. We also acknowledge and thank the courage of the family members of the affected, that were affected, who sadly lost their loved ones, the Ramphele family and the Mabubula family. And we also wish to thank the board chairperson of the Office of Health Standard Compliance, Dr. Genoshi, and the entire OHSC board for its governance role in ensuring that the OHSC mandate and the Health Ombud's mandate is supported, fulfilled with integrity and accountability. We thank the presence of the leadership from the Department of Health. From the National Office, we have DDG Dr Mamphela, and we also thank the senior leadership from the provincial offices in Limpopo, the delegation led by Mr Mawasha, the CEO of Polokwane Provincial Tertiary Hospital, Mr Kruger, as well as the CEO of Wits Donald Gordon Medical Center, Dr. Sue Tager. We all have a duty to reflect on the significance of the findings and the recommendations that have emerged from the two reports. And let me walk on the words of the Health Ombud and the Minister in emphasizing that these reports are aimed at learning lessons and preventing such mishaps and tragedies in the future. And this is not only limited to the two institutions whose reports were released, but it goes beyond, and it should be in the entire healthcare sector. The Health Ombud recommendations compel all of us in our various capacities in the line of providing health services that we have, and we advocate for a dedicated strategic focus on capacity building, resource allocation, but most importantly, and the cornerstone of service delivery, which is always exercising a patient-centered approach. In that way, we'll be able to foster an inclusive healthcare environment where every individual feels valued and cared for. Now that these two reports are released, the leadership and managers and all healthcare workers in the two institutions or in all the affected institutions will then commence and are poised in ascertaining that all these findings are addressed. And from the Office of Health Standard Compliance, will also commence with monitoring the implementation of these recommendations as part of ensuring accountability and progress in translating these insights into tangible outcomes. To the families and to our communities at large that we serve in all our health institutions, we recommit ourselves to a vision of a healthcare system where safety, compassion, and excellence are not just aspirations, but realities that in the foreseeable future we see. Our collective goal is to restore trust and strengthen the quality and safety in healthcare in South Africa. I wish to acknowledge the dedication and the resilience of all the healthcare workers that are trying hard in delivering care under demanding circumstances. Thank you very much for attending this press brief, and thank you, Program Director.
You can come. If we have extra copies here, I should like us to give hard copies to the members of the family that are here present. How about loading?
If the family members can come in front to collect, to also receive the reports. Thank you so much for those closing remarks. I'm not going to say anything further because the CEO already closed the briefing. Thank you, everyone, for coming. The briefing is officially adjourned. Thank you so much.